Hey, what's up, everyone? It's Dr. Glenn Vo, and thank you for joining us. Another edition of Nifty Thrifty Dentist Podcast. Man, I got a special guest, Dr. Kiana Shaw. Dr. Shaw, what's up?
Hey, what's up? Thanks for having me on the show.
Man, I'm super excited to have you on because here's the thing. I've been following you, so many different things we're going to get into. And I'm like, look, I got to get this man on a Facebook Live. So I'm super happy to have you on. But, for those out there, for the few people who don't know who you are, Dr. Shaw, why don't you give a little bit of background? Because, yes, you are wearing a white coat, guys. If you can put one and one together, yes, he's a doctor too, just like us. But, Dr. Shaw, talk a little bit about yourself and, besides just doing dentistry, which you have a really successful practice, what else are you involved in?
Well, I am a general dentist. My passion is in dentistry. I grew up in Germany and did my undergrad in the U.S. and dental school in the U.S. and all the fellowships afterwards. Picked up a Southern belle and got married to this wonderful lady and had a couple of kids and got sort of settled down now in Palm Desert, California, where I am involved in a host of different things outside of clinical practice.
Yeah, and here's the thing. I mean, yes, teaching courses, we'll get into that, and just really just influencing dentistry. And the one thing that you're so passionate about, and I'm actually really looking forward to hearing this from you, because you're like, Glenn, this is exactly what you do. And that's called peer-to-peer, right? Working with peer-to-peer. Explain that whole process and why that's really important for all our dental colleagues out there.
Yeah, let's give you a little background on that. Peer-to-peer is a very big idea. It did really well for the financial sector when blockchain came out, and you had all of the different Bitcoin this and private lenders cutting out the banks and getting lending licenses and essentially creating a lean, mean machine that was between a peer and a peer and another peer. So at that time, I had moved here to California from Chicago, from Illinois, where I had 6 offices, and sort of started going back to school and taking MBA courses at night. And I got involved with this financial industry, started learning a lot about it, advising their executives about how they can enter the healthcare space. Then I lectured for them in San Francisco, the Lendit, and I lectured for them in China and Shanghai, pertaining how peer-to-peer could be an effective solution in the healthcare industry on a financial side. And, throughout the MBA and learning all these new things that we don't learn in dental school, the ideas evolved to a place where I'm thinking to myself, okay, if they can create that for the financial sector, why can't we create that for us in our industry, for healthcare, for dentistry, for medicine? As you know, there is a big problem that I've been seeing in our profession eroding in the last decade, last 14 years I've been practicing. And it started with looking at big pharma, insurance companies. You got the management schemes and ownerships, lobbyists, excessive regulation, and they're sort of putting us in a corner on a chair. Everything trickles down to the chair side, from material selection to your staff to the way you want to practice. And everybody wants to interfere with the patient-doctor relationship because it's a lucrative business.
Yeah.
And to some point, they have succeeded. But besides all of those couple of things I mentioned, we need another planet over here, a peer-to-peer planet.
Right.
And this idea could be applied into continuing education, could be included into supply chain, which I want to talk to you a lot about, purchasing power. It could be applied to our personal lives. And seeking the advice of doctors and leaders that have done this, have seen all of the problems, would, for example, enable you to not make the same mistakes. So the idea evolved into a global summit in 2018, and then another executive summit in 2019, and then subsequently the top 100 doctors, which we will also, I'm sure, get into in this discussion today.
Well, no, I love that, and that's the thing. It's just you see all these issues. I mean, Dr. Shaw, you're in all the different groups there. You've been on so many podcasts, and it's the same thing over and over, right? It's the same situation, the same problems there. And I love what you bring up, because that's something that we've been trying to do in Nifty Thrifty Dentists, right?
Yes.
Just cut through all the BS and get straight to the doctor, right? Just cut all that out so that the doctors can get the best price and whatnot. And then, and the companies, the vendors, they get a good ROI too without having to just go through a lot of BS there. And
Well, you know why they're getting a good ROI? Because they want to make the sale. That's what they care
yeah,
about. So
right.
their customer acquisition expenses are sometimes astronomical, up to 30%. When you go to them and you make these deals with them and you say, hey, I'm going to bring you volume and I'm going to bring you multiple different doctors. Now, their customer acquisition costs are almost nil. They're getting their customer on a platter so they can extend those savings to us. That's why what you're doing is a classic example of what peer-to-peer can achieve.
Yes, yes, and I love that, and I love the fact that you're talking about this. So, let me ask you this: so, other than that's a pretty easy example, right? You know, supplies and vendors and whatnot. What about other areas that peer to peer can help our industry? Like, what other areas?
The peer-to-peer, the lifeblood of this is going to be the dentists joining together. We're with
Yeah,
our board that we have formed is we have to get dentists, our colleagues. At times we have big egos, big differences at times, and it creates a lot of barriers for us to do what needs to be done to save our industry. The board is leaning as these ideas develop into an independent dental association of some kind where we can not offer what you're doing, but also all of the other verticals that are necessary for the private clinician, young guy that comes out with a $500,000 in debt or whatever it is,
yeah,
to be able to go and work for him or herself versus working for somebody that promises him 30% of collections and some benefits that never materialized. And then you have a supervisor, floor supervisor, telling them to go in here and do a filling and go
yeah.
in there and do a crown. And this is not what we signed up for. The only way they can prosper is equity equals autonomy equals freedom. If you want to live your life the way you want to live your life and you want to create what you envisioned when you went to dental school, freedom to schedule your time when you want to work. I work on the weekends because I choose to.
Yeah.
Nobody's there to stop me. You want to have a family, you want to get married, you want to have a house. You can accomplish all of that. I took $100,000 investment, started at a 1,000 square foot place, negotiated all my subcontractors and vendors with 100 grand. My first year out of two chairs, I clocked in over 800 grand. In year two, we went over 1 million. And any of my colleagues can do this, but they need the right guidance and they need the right support. Not every 22-year-old that wakes up in the morning and becomes a Facebook expert, and the next guy that with the millions of CE options that are out there where you don't know which one to select. So we have to turn to our colleagues that have done this for a long time, seek their advice, and without us, those third parties have no chance of survival. They come to us. We empower them. We should be empowering ourselves.
I love that. I agree. You know, one of my friends, Paul Goodman, just made a comment here, and I'll just read it. Declining insurance reimbursements like eating donuts on a treadmill.
I love it. I mean, Bill Bashford, on Thursday, I'm doing a podcast with him just on Insurance Monster. What he's telling me is he's got offices that are doing 1.5, 2 million, 5 million even, that are just telling these patients, hey, we have our fees. We don't diagnose and treatment plan patients based on what the insurance company says. We do it based on what your needs are. So we're gonna give you our receipt, and we help you, we file for you, but we're out of network. We don't accept insurance. So this is his contention. And I'm very excited to hear what he has to say. But I'm doing the same thing that I'm doing with you, doing with Christensen on CE. I'm doing with Blatchford on
Yeah.
insurance. I'm doing with Williams on productivity, the $10,000 a day guy. Then we're going to package all that information up and hand it to our colleagues, and they can decide what they want to do with it.
I love that. I love that. And that's the thing. I mean, it's I see all these. There's all these successful dentists out there, but the one thing that they have in common is that they learn from somebody, right? No one just pops out of there and just starts killing it. Or no, everyone has mentors. Everyone has, and that's what's so great about what you're doing, because really, I mean, you have this passion. You're really doing the rounds, man. You're really going. You're like everywhere, but you really have this spirit. You're really trying to spread this message that, yeah, dentistry. If you don't have that community, if you don't have that peer to peer relationship, I mean, it's a lonely place, right? You can't just be on this island by yourself. And so, I'll tell you what. I actually have a question. Can we take a question from the audience here?
Sure.
Yeah. So let me just throw. Let me see if I can clear. So okay, so the question here, I can't. The question is so long. Let me see. Okay, it's going to cover: can peer-to-peer to be used to take back our value against dental insurances? Seems to me there is enough to go around, but the dental insurance has depleted our value in the market. So we have to do, I mean, we have to work harder and harder for deeply discounted prices. We only have so much time for our family and kids. So the question in that long question is, can peer-to-peer be used to take back our value against the dental insurance companies?
So there's two ways we can attack this as an industry. We can just start denying them. The same way they prospered and became big and came out of nowhere was because we started accepting them. The simple solution is to not accept them. But a lot of doctors are apprehensive about that patient that's on the phone call and says, hey, first thing that comes out of their mouth is, hey, do you accept my insurance? So you don't want to lose that patient. I understand that. So I'm exploring ideas with other colleagues when we do develop this independent organization that we have solutions for your malpractice, for your overhead in the office, as well as for the insurance scenario. But those ideas have to come, and they have to come outside of our communities. And yes, we can take our profession back. You said something about me having this passion. I want my kid to be a dentist. I'm not going to lie to you, but I don't want my kid to end up like a pharmacist and an optometrist. And the only people that can stop that now is us.
Right.
So yes, the insurance question, and this is a question that from the viewer, I'm going to be asking Dr. Blatchford and have an answer for it because he's the leading a dental coach, is one of the leading dental coaches in America. I don't have particularly a specific answer for it, but and I don't want to structure anything that involves a large sum of monies and go out and tell every dentist, hey, invest $20,000 in this and do all of that. It's not, that's not my game. Money is not my objective. So if we were to do something like that, there would have to be a consensus among dentists. We would all have to invest into a fund and use that fund to essentially create insurance settlements for our malpractice problems, for our patients. It's going to involve, but once the peer-to-peer idea is cemented and dentists start coming on board, then we can all as a unit, as one unit, decide on how to beat these third parties that are constantly have their hands in
Yeah,
our operatories and in our pockets.
exactly, exactly. And and that's, I think that's something that really strikes strikes a chord with all of us, right? I mean, you see it in all the groups. They're like,
So
gosh,
tired of it. So
why
tired of it.
are they doing this? Why is everyone just taking advantage of us? Why, of course the insurance thing is the biggest thing, right? But it trickles down to a lot of things there. And then there's always someone that says, okay, let's do something, right? Let's do something. And then there's like no one says anything, right?
They're
And
afraid. There's also the fear factor. You have these companies that have 500 offices, 400 offices backed by hedge funds with unlimited resources. They could blackball you. They could do a lot of things. In my opinion, fear is something that crawls up in your soul. It's like decay. It's a disease, and you have to take the first step. Yeah, talk is cheap. People have to take the first step to be able to actually take it to the next level.
so what is obviously you're putting the idea out there. You're actually sparking that, right? You're sparking the idea in everyone's head right now. And like I said, you've been on a lot of other podcasts and all the other Facebook lives, and you've been talking about this. So for those who are watching right now, right, and they're thinking, okay, all right, Dr. Shaw, let's do it. I think it's a great idea. Let's do it. I mean, what's the first steps? Like, what are the first steps, or what do you envision the first steps being?
The first step is to create more channels of information exchange. Information is power. Peer to peer is access. Access is power. So in order to first of all, we have to change the entire environment around dentistry. When you have all these recruiters going to these young doctors, telling them, giving them promises of a lifetime, if they're working for them, they're making their dreams come true. They're not
Yeah.
making their own dreams come true. So once we establish the information exchange and these people are getting the right information, you have 20 some thousand people on your network. I got close to 50,000 people on my network. Other people have these. Once that environment is sort of established, where these third parties start realizing they're guests in our profession and guests usually that don't behave get kicked out, then we can start talking about, hey guys, what structure do we need? Do we rely on organized dentistry that's corrupted and has sold us out? or do we start something new that's clean and pure, that is not controlled by one person or one group, but it's self-sufficient of a system? That's how blockchain succeeded, because everybody had their eyes on the balls. There was a ledger up there. Everybody could see what's going on. So those ideas have to flourish further. But at this time, for the past 2 years, what we have achieved is, for example, bringing 70 some countries together with the top 100 doctors in different areas of authorities. These guys are rocking the entire industry. So these are all examples and first steps. So everyone can participate in this at this time. And once we establish, if we need to set up an independent global organization, not a domestic, then continue please feeding me those ideas, and they will be revealed to our groups, and that's how it all starts. That's how you take that spark and turn it into a fire.
I love it. I love it. And like I said, I love the passion that you have behind this, because, this is something that you're really passionate about. You've been, man, really literally making all the rounds there. But you mentioned something that I actually want to touch base on. You mentioned the top 100, the top 100 dentists, right? Like, I saw that list. A bunch of my friends were on there. I was super proud of them. And then when I asked you about it, as far as like, oh, obviously these doctors that you pick, some of them I know. I'm like, I understand why they would be in there. But then you said, well, Glenn, it's a lot deeper than what you think. And I'm going to tell you during the Facebook Live. So here we are. I want to know what it is. He said it's a lot deeper. And so I've been waiting. I've been waiting for you to let me know that. But explain that, the top 100 dentists, why you created it, what was the criteria, and other than them being really great dentists, because some of my friends are on there, but you said there's something more to it. So explain that to me.
So we had out of the over 20 countries that has been published since January 1, and also over hundreds of groups that we have gotten very positive responses. There were some that were not so positive, because collegiality sort of went out the door, and people didn't start asking questions as to what this is about. There's many lists out there, from top CE leaders to 40 under 40, and so on and so forth. Um, and you develop a system. These are not all clinicians, first of all. We put together a board of regions that helped select and also helped nominate, and other people could nominate. And we wanted to look for a variety of skill from different areas of the world and different particular specializations. There was we had people that are heads of labs that are dentists, people that are heads of in the media, in the journalism sector, that are also all mostly practicing. We have had people that took different paths in life, be it in the supply chain. So for us, that was another example on how to create a peer-to-peer system where we can turn to our colleagues from different industries across the world and get their opinion and have access. Access is the key word. So just putting a list together and picking 100 people, no, that's for somebody else that sells $89 plaques. This was this is not us. We are actually not $1 was exchanged. I have over $1,000 probably collected on volunteer time for this project, and so to the Board of Regents in looking at application, discussing people, and bringing them on board. And if we grow this and grow this and grow this, it's not about being the top or best of anything. It's about establishing a platform and an example of a peer-to-peer system that could possibly work and give us the access that we need. How do you think we are able to get into all of these different venues and talk with all of these different? Because we now have access, and that helps us.
I love it. I love it. And then, so for those who, who don't know about the list and they're hearing about it for their first time, they're going to decide, where can they actually go and see it? Is there, is there a website for it? Is it on a Facebook page, or where is it exactly? The entire list. I've seen it many times, because my friends that are on it, they let me know about it. So I was excited for them. But for those who haven't seen it yet, how do they find it?
So top100doc.com.
Okay.
And
And we'll put that, and later on, Dr. Shaw will put that link in the comments, and I want you guys to take a look at it. Like, you understand now the significance of the top 100, and you'll see some people that you're very familiar with. Like I said, I have some good friends on that list. I'm really proud of them, but really proud of outside of them just being good dentists, but what they also do for our industry.
Yes, we can definitely post that, and we would really encourage our colleagues to nominate more and more leaders that we can have the board evaluate and possibly involve with us and engage with us with their ideas and plans for the future. And you yourself would be a tremendous asset to this operation if you can pick your brain on how we can more efficiently create venues for doctors to get cheaper. I was looking at a let me give you an example. I was looking at a 5 shelf mobile thing for my oral surgery, and online I find the same thing for $270, whereas the catalog that the dental people, I'm not gonna mention any names, was like $590. Are you like, are you kidding
Oh
me?
gosh, yes,
The
you're
same
speaking.
exact product.
Oh my gosh, you're speaking my language there, and that's part of the reason why we create this group is that we find some different ways to, the thing is this. I mean, I'm not trying to discredit any the dental equipment industry or the supply company or anything like that, but come on, let's be reasonable here. Yeah, like the cart, right? The same cart that costs couple $100 on Amazon and they're selling it for almost $1,000. Let's get reasonable here. And yes, you're speaking my language there. But yeah, those are the type of things that look, we are the low. Sometimes it feels like we're the low hanging fruit, right, Dr. Shaw? The
Yeah,
den-
well, that's exactly the point. What are they being advised on? You don't have time to look for supplies. You should order through us because we give you savings and better service. And it's like, okay, hold on a minute, eh? When I had 6 offices, another problem with our profession is when these management companies came around, everybody thinks that they can go set up 4 or 5 offices. Not everybody, yeah. Most doctors that I meet, that they can see get 4 or 5 offices, and then they're off skiing in the Alps, and everything is good and everything is dandy, and they're making a ton of money. I'm making more money out of 2 chairs, taking care of my patients, giving them the care that they need, establishing good rapport, just through the referral systems and working 2 3 days a week out of 2 chairs. I'm doing more than when I had 90 plus staff members and 6 offices. Put that in perspective, and I don't have the stress anymore. I don't have the overhead, the headaches, my benefits. When do I get a vacation, raise? All that is gone, and I had peace, and I practice for myself, and I'm my own boss. And Dr. Williams, for example, he's $5 million. What else do you need? You can do that out of one practice if you wanted to, and you're good.
I
I don't
love it.
need that much money, so
So based on that, because like I said, what you just said there, that's like, wow, such an amazing story, right? So let me just kind of dive into that because obviously when people hear that, they're gonna say, what did he do? Oh my gosh, that sounds like the ideal situation. So let me ask you this: how did you transition from having multiple practices to now going down to one and working less and being less stressed? What was like the main key points or main things you did to get to that point?
almost panic attack. I mean, I was so frustrated in Chicago, going between Rockford and Southern Illinois and servicing all these 6 doctors. Nobody really does the job as good as you're gonna do it yourself because you have your heart and money and resources and everything else into it. So I came to California and left that life behind, and essentially got into education heavily, more fellowships, more diplomats. And I realized that you have to work backwards if you want to create an environment. Now I'm in an area where there are a lot of uh, retirement people here, and they have a lot of credential. There's a lot of issues with credentialism. I'm into implants, so it's a good fit for me. But you got to work backwards. You got to envision what the end product is going to be, just like you envision how your crown and your angulation, all of that. So when you work backwards, location is the first more important thing. Do you want to be in a skyscraper or in a tall building where you have to invest a tremendous amount of money in multi-channel marketing to draw the patients up the stairs? Or do you want to be in a high foot traffic area? I chose an area, small, high foot traffic area, got in there. Then I had learned so many things through the past from offices that I had, all the tips and tricks. So I knew how to negotiate with the landlord, how to have the landlord fix everything in my office, and the flooring and all the beautiful things they put in here, and as tenant improvement, and implement that somehow in a negotiation into my rent over amortized over X amount of years. I would pay them back. So upfront cost essentially zero. Then I go to a company and take $120,000 CT machine I got in there, and I told them, hey, I'll buy it from you. I'll sign that contract. but I'm not going to pay you for the first 12 months. I want to pay you after because I got to get my business up, and that's my number one priority. If you don't like it, I'll go to another company, and then I'll go to another company. Eventually, one of them is going to do it, and they did. And so there was 100,000 or 100 grand machine in here, all done in the office. My rent was like, you don't want to have five, six, $7,000 rent. You want to keep it around 3 or 4 if you want to have a comfortable, quiet life. So rent came in at 3,000, would increase every year, X amount, 3,000, whatever it was. And so one by one, I negotiated them into a position where I had, two very simple chairs. They weren't the nicest chairs. I replaced my chairs with a $30,000 investment after 8 months of being into practice. I took the Chinese chairs out the back and brought in the most beautiful chairs you could. But this is what you got to do at the
Yeah.
beginning. This is
And
what
so
you got to do.
what
Instead
you're
of taking
saying
a
right
half
now,
a million dollar loan from the bank, you
oh
can
god.
do it with 100 grand. That's all you need.
And how do you feel when you see? Because and like I can tell you how I feel, but how do you feel when you see like these young docs are opening practices and they're talking about, okay, I had to buy this and buy this, and they end up spending like $500,000, right? And they're already up in their ears in debt. I mean, when I see it, I shake my head. How do you feel when you see that? When they feel like they have to buy all these things?
Because they're advised wrong, and comes right back to the peer-to-peer thing. If they get the right environment, if you have the right environment and you advise them properly, they lie. It's a lie. You don't need a $500,000 to start a practice. When you come out of school, this is how they put the wedges between us so we can't collaborate. You come out of school with a $500,000 debt, you don't need another 500,000. They're scaring you, so you go work for them for 20%, 28% collection, and you'll never ever be in control and in charge of doing the way you want things done. You don't need a $500,000. You don't go out. What kind of an example can I give you? You cannot get the Ferrari the first day you go on the job. It's not going to
Sure.
happen. You got to be humble, and you got to grow. Everyone who has that I know of that has done it well and big came out of humble beginnings,
Hmm.
because that's how you appreciate your environment. So yeah, you can probably do it for less than 100 grand. You'll have one person walk into that door that's gonna need 10 crowns, and you're gonna start it, and you'll never look back again. That's how it goes.
I love it. I love it. Such great advice there. And guys, if you like what you hear, if you like what you hear, type in the comment section peer to peer. And if you really like what you hear, I mean, Dr. Shaw, like I said, he's been on multiple podcasts. You've probably seen it. Listen in, because every show, every platform he's on, there's always a different take. And like I said, he's going to be with Dr. Blatchford pretty soon because of that big insurance issue, right? So I'm can't wait to listen to that, and I can't wait to see when you talk to Dr. Williams too. So this is a man on the mission, guys. But look, it should be a mission for all of us, right? Not just for one person, for all of us. We should want all the same things. I love it, and but you know what? I want to talk. I want to kind of steer in a different direction here, and the direction is this. Okay, you've been pretty modest here. Okay, you have a successful process, but you left one big thing. You're an educator. You're a very respected educator. Okay, and here's the thing. I want to talk about that. And one of the courses that you're pretty passionate that you teach is what? What are the obviously you kind of gave a little tip, right? You gave them a little hint about surgery, right? That was the hint there, guys. But talk about those courses that you've been teaching for a while now.
In 2014, I had a great passion in dental school. I would go in and clock out in and out of oral surgery all the time. There was a real cool oral surgeon that taught me a lot of stuff. But when I got out, I started doing a lot of wisdom teeth, and the wisdom teeth led to me wanting to do implants. And I figured a lot of my colleagues might be interested in the same scenario. You don't learn a lot of complex extractions in dental school, so I started the Extraction Academy in 2014. And turned about a year and a half later, I turned to the head of New York University oral surgery department for their head for postgraduate studies in implantology. And he joined us, Dr. Wiedemann, and we started doing these workshops all across the country on a regular basis. We do them. We got a dozen this year, and there's an online series where we took all the academic stuff. I mean, all of the didactic stuff out of the classroom, of the workshop room, So we cover everything from preclinical preparation to anatomy to all of the different things that you would need to have a successful practice where you're doing OS for the GP, inpatient and office. So we cover everything from pharmacology to sedation to complex extrantia procedures, newer techniques. You got to understand that in 1970 or so, around the 70s, when they came out with a handpiece that's 3,000 RPM,
Mhm.
innovations are new in our industry. You do not want to know what they did before that for these kind of situations.
I can only
But
imagine.
yes, it's a very painful scenario. But today we have constantly new innovation. And always one point I make to all my colleagues: if something in the office that when you're practicing bothers you, find a solution for it.
Yeah.
That's how you innovation drives our industry forward. But education, if people, what I never understood is if you had a tooth that you extracted also and you have a natural socket, why don't you put the implant in? A lot of doctors are that's your natural guide. A lot of doctors are interested. So in the Extraction Academy, we also teach immediate implant placement. Philosophy has changed about buccal bone. You want to maintain it just like as important the margin to a crown is to a prosthodontist, the buccal bone is to us now. And we think differently. We think about what's next for this patient, about the whole idea of exodontia. So I'm heavily involved in that. I'm heavily involved in stem cell research as well as autologous growth factors, PRP, uh, um, things of that sort. I lecture about these topics domestically and internationally. I travel a lot internationally as well.
Yeah, and the all the things that you bring up. I mean, for a young doctor, for those young docs who are watching right now, those are the type of things that you need to be thinking about getting into, right? Things that growing your skill set, because yes, there's bread and butter dentistry, right? But if you want to get your practice to a certain level, Dr. Shaw, wouldn't you agree? You need to start picking up some of these surgical skills instead of referring or sending them out of their practice.
Yeah, I mean, sometimes you have doctors at our workshops that say they haven't done extractions in 5 years. I'm sitting there, I'm like, what are you doing? Are you doing crowns and fillings and that's it? Or are you doing then? I mean, how do you make ends meet? Extractions, the vast majority of patients going to a dentist have some sort of a problem or pain.
Yeah.
You cannot afford not doing extractions in your office. There isn't enough periodontists and oral surgeons to do extractions on a 300 plus million Americans. I used to do extractions in between patients, the wisdom teeth, the whizzies we call them around here, as a, as a fun a little extra moneymaker in the office between the real procedures of the root canals and the crowns and all of that. So you have to do at least case selection is important, but you have to have some skill in oral surgery to make it and to make it big. You can't deny these patients all the
Yeah.
time.
Yeah, and here's the thing, everyone's trained differently. Everyone's gone to different schools, different programs. And what I would say is this, okay? If you only know what you know, and if you feel like your skills, your oral surgery skills, or your surgical skills are not where they are, then there's resources out there. And we're just talking about it right now. You created this course because you saw a need. You saw a need when you talked to somebody and they said they haven't done an extraction in 5 years, right? So let me ask you this: for someone with little skill, right? That not the much. Now, let me rephrase it: not little skill, but little experience in doing surgery. And that for that doctor, what would you say to them when they're thinking about coming to your course?
Well, you have to have the courage to get your feet wet. I would tell them to start just like endo. We were all scared of doing endo. Oh my God, opening up the central incisor, taking the nerve out, and blood everywhere. But we did it though, right? We did the central, then we did the lateral, and then we did the canine, and then some of us are doing molar and second molars. And we start with teeth that have maybe one root where you can apply circumferential forces to extract it easier. Then we go into more complex scenarios. So at some point, you got to overcome that fear and do it. And you realize I've probably done over 30,000 wisdom teeth cases by now.
Oh my
And
God.
I used to go in certain clinics where they had them in the rooms, and I had a doctor follow me and do surgery. They become very easy to a point that once you master it and you understand the concepts and how bone is, and you get that finesse and that touch, then you don't think it about them anymore. You just do it.
I love it. I love it. So, so we're definitely gonna put the link there. And look, Dr. Shaw, you're in the Nifty Thrifty. You're in the Nifty Thrifty Dentist Facebook group. And look, you got me excited about that course. Obviously, there's a lot of exciting things we talked about here, but I love surgery too. And I know a lot of people who are watching right now are thinking, okay, you convinced me. We want to do it. So, what can you do for our members who are listening right now or watching right now who might want to take your course? What can you do to help us out here? Nifty thrifty deal.
Let me get you again. Money is not of great interest to me. I have a management company that does the day-to-day operations. We're gonna probably 20-30% off. I'm gonna speak to
Woo!
them,
All right.
and maybe more. Maybe I can get them more, but I'll let you know that final number, and hopefully our colleagues will take the course. Or there's other extraction courses, and there's one thing I learned in MBA school: the more your skills go up, the more society, the more valuable you become to society, the more earnings you're gonna have, the more people are willing to pay for you. Okay, so you gotta up your skills.
I
You
love
gotta
it.
do that. All of us have to do that.
I love it. Okay, so Dr. Shaw's going to get back to us here. He says at least 20%, maybe more. I don't know, guys. If you keep on typing in the comment section peer to peer, he might just up that discount there. But he just teaches us a surgery course, and I'm super excited. But I'm also really excited about what you're doing with the peer to peer. You definitely got me more motivated here. And guys, at the end of the day, we need to come together, right? I mean, there's organizations out there. There's other groups out there and they try, right? But we got to keep trying harder. And that's what it boils down to. So let me ask you this before we jump off, Dr. Shaw. I'm going to ask you this. You've been on the podcast, Facebook Live circuit. Man, you're making this circuit. What's the next destination? What's the next podcast you're going to be jumping on next so that people can follow you?
I think I have two on. Let me go here. I have two on Thursday. I got to go to Arizona to meet with the singing dentist because he's going to do a parody for us
Okay,
about
cool.
peer to peer. I got Dr. Blatchford on Thursday night.
Insurance.
I think I got Dr. Christensen coming up the following week. We have. There's a good one. Jay Abraham, who's the Godfather, who's known as
Marketing.
the Godfather of marketing. I'm meeting him at his office
Oh my
on the
gosh.
6th for a podcast because that's also for the benefit of dentists. I want to see how we can create more better referral systems. He's like the genius of referral systems.
Oh yeah, I love it.
Then we got
Guys, I mean, so there we go. Dr. Blatchford's next, so you definitely want to tune in there, and then you'll also find out where. But I'll also post it in the group as well. We got some people type. So guys, if you want that discount on that surgery course, type in the comment section peer to peer here. So let's show Dr. Shaw our support here. He's got a man. He's got an amazing vision here.
I got another one coming up. That's a good one. It's with Dr. Uche Odiatu.
Oh,
He's
you guys
into
got to talk about working out.
Well, there's a correlation between your personal health and productivity. Let's see what he has to say, for our
Yeah, gosh,
colleagues.
I love that. I love that. I'm looking forward to all those things. So, Dr. Shaw, thank you so much for jumping on.
Thank
Truly an
you.
honor to have you on. I mean, I love what you're doing. And before we jump off, I always give my guests the last words. So, the last words that you want to talk about in terms of peer to peer to everyone who's watching right now.
A dentist is going to be your best friend. We have to get over our egos and differences and come together. And that's the only way we are going to survive, and our industry is going to prosper and be autonomous for us. And we're going to be able to execute what we signed up for and the kind of life we want. That is my message.
I love it. That's a great message. And there's nothing else I can say that'll top that. So, guys, thank you so much for tuning in. Dr. Shaw, thank you so much for joining me. And guys, we'll see you next time.
Thanks so much.